Just announcing tonight that President Obama is canceling his trip to Rhode Island and New York tomorrow so he can continue to deal with that Ebola situation.
Well, the president was supposed to be right here in Connecticut today, but he had to cancel that trip as well so he could hold an emergency meeting about the deadly Ebola virus.
As the concerns continue to grow tonight, we wanted to know what's being done to keep all of us here in Connecticut safe. Health officials say they're on it. News 8's Bob Wilson went digging for answers tonight. He joins us live at Hartford Hospital with more. Bob?
Yeah, we get the head of Hartford Healthcare System, which is 5 hospitals, including Hartford Hospital as their flagship. And they say they've been taking this very seriously. As a matter of fact, over the last month, they've been screening for Ebola patients coming in. They do all the tests right away. They meet you at the door. They have protocol in place. And they say now, with the concern that 2 nurses have tested positive in Dallas, they're worried about their own healthcare workers.
This is a nasty virus, and there is not a great margin of error.
When it comes to Ebola, the Hartford Healthcare System, which includes Hartford Hospital, is not taking any chances.
The nurses are at higher risk because they have more contact hours with the patient. They're literally there every hour, every minute. They're in direct contact.
After a second nurse tested positive for the virus in Dallas, doctors here in Hartford have been on conference calls with the CDC and the State Health Department this week to make sure they're up to date on the latest changes in protocol.
There is a risk that in removing the gear, if you have secretions, body fluids that remains on gloves or on hands, and you touch yourself back of the neck, back of the head as you're removing all of your gear, we think that is the time of risk.
They've also tightened and conducted drills on Ebola procedures if a patient comes in with the virus.
And we know what to do, we know how to isolate, we know the questions to ask, and we know what to do.
Now, the head of Hartford Healthcare says that the screening process starts immediately as soon as somebody comes into the ER. If they qualify, then the isolation process begins immediately. They're taken to a section of the hospital where they can be isolated and treated there and keep it from spreading. And he says, believe it or not, they've actually screened numerous patients who have come to the hospital and have fit the criteria.
We have had folks come through who have been traveled to West Africa and who have presented with fever, and thankfully they have ruled out for Ebola.
Now, an incredible thing is Hartford Hospital says if Ebola were to make it into their hospital and they have to treat it, they have nurses that have stepped forward and already volunteered and said, I will take those shifts and I will go in there and take care of those patients. They said that's incredible that their employees are that dedicated to health care. And also tomorrow afternoon, Governor Malloy is holding a news conference at the Armory with state health officials to discuss the precautions the state is taking. I'm Bob Wilson, reporting live in Hartford, News 8.